Probably the secret sauce for the company at the beginning, and I would still say till today, was that it was founded on a very durable piece of surgery that works. An in situ bypass is a fantastic piece of surgery, and because we had a durable procedure that we built the company around, the company wound up being durable. But we knew that we had to get bigger and we had to diversify. So there's two big trends that LeMaitre's focused on. One is this endovascular revolution, and one is the move towards biologic products. Most vascular companies have moved towards endovascular. LeMaitre chose not to. LeMaitre chose to stay devoted to open vascular.
It turns out that open vascular surgery performs very well up against specific endovascular procedures. If you have a blockage in an artery in your leg and you may face an amputation, big study came out, 1,800 patients, which proves that it's better to have surgery first in your leg than have an endovascular procedure, not just in terms of efficacy, but in terms of cost and long-term results.
The other trend going towards biologic products, I think LeMaitre's been on the forefront of that. In general, vascular surgeons feel that biologic devices are better used in infected fields rather than prosthetic materials. So most companies sell Dacron and PTFE. We do that, of course, but we've moved most of our product line towards a biologic device taken from sheep, cows, pigs, cadavers, and those biologic implants or prostheses tend to perform better in an infected field. So the world's going more towards those types of prostheses rather than synthetic prostheses. LeMaitre's been pretty aggressive in following that trend. Another big trend is the explosion and the growth of dialysis access. And LeMaitre has acquired its way into that field with the Artegraft acquisition and also a long time ago the AnastoClip acquisition. So as that field explodes, and it is exploding, LeMaitre's part of that growth as well.
In addition to the vascular surgeon, who's been our main call point for the last 25 years, there are some devices which get used not just by a vascular surgeon, but also by cardiac surgeons. We call them crossover devices. For example, a biologic patch, when it's shaped like a small strip, might get used on a carotid artery, but when it's shaped more like a big square, it might get used in the heart. And so these crossover devices exist, and it turns out that over time, as we sold to the vascular surgeons, cardiac surgeons started to use our devices as well. Our products have been on the market for years, if not decades, and they're proven in all sorts of situations with a lot of data. And so if a surgeon has a case and they need a device, they can come to LeMaitre as a trusted partner, and our sales reps will be there by their side, supporting them in their cases and providing information they need to ensure an optimal outcome.
As a surgeon that works with LeMaitre, I hope you find our products to be high quality. Remember, they're all handmade, and so the fact that we have very long-lasting employment relationships with our employees means the person who's making your valvulotome might have been the person who was making it 10 or 15 years ago. We're trying to keep those relationships solid to give you a high-quality product, a consistent product that's always the same every time you open the package.